So my name is David Meya. I'm an associate professor of medicine in the Department of Medicine here at the College of Health Sciences, Makerere University. Currently, I'm also a postdoctoral fellow under Thrive 2. And for my postdoctoral research, I have been looking at patients who have cryptococcal meningitis and are HIV infected, who have recently started antiretroviral therapy. As part of our studies, we found that patients who had recently started antiretroviral therapy and came into the hospital and were admitted with cryptococcal meningitis had higher mortality rates compared to those who were antiretroviral therapy naive. And so one of the things that we have done is to try and figure out why those patients who have cryptococcal meningitis and have recently started antiretroviral therapy have higher mortality rates. And so part of the evaluation of those patients involves taking fluid from their spine. And once we have that fluid, we essentially keep it, analyze it, and later on we can then come back and compare those patients that had recently started on antiretroviral therapy and compare those findings in this fluid to those patients who had not yet started antiretroviral therapy. And one of the things that we have found is that there are particular cells that these patients have, part of what we call the CD8 T cells, which have lower immune activation. Or to put it more simply, that once they start antiretroviral therapy, their cells, instead of being really active, sort of become a little more quiescent. And so one of the things we are wondering about is whether if those cells become quiescent and less active, is that contributing to their poor outcomes? And so what we have done is take those cells, this machine called the flow cytometer, and we have stained these cells, looked at the markers on the surface of those cells, and that's how we got to know that once you've started antiretroviral therapy recently and you have cryptococcal meningitis, the cells, the CD8 T cells, are much less active compared to those patients who had cryptococcal meningitis but hadn't started antiretroviral therapy. If you had a patient who had been started on antiretroviral therapy and you're a clinician, a young clinician, and this patient comes into the hospital and you do this lumbar puncture, look at their spinal fluid, and they have cryptococcal meningitis. If that patient has recently started antiretroviral therapy, say in the last 2 weeks, I guess the question I leave with you is, what would you do?